Malignant otitis externa. Hey guys, welcome back to my series of video lectures. So, this topic for today is malignant otitis externa. Malignant otitis externa is also called the necritising otitis externa. So, the plan of action for today's lecture is that we'll learn a few subheadings under the topic malignant otitis externa. We'll know how to define malignant otitis externa. We'll know the causative agent of it. We'll also come to know the age group of people who are going to be affected. We'll also come to know the predisposing factors. And we'll come to know the clinical features. We'll also learn the associated features. We'll also know what all cranial nerves in case it is involved. We'll see how we diagnose it. We'll see what is the location where the pathology is present, and we'll know the investigations, how to investigate in order to diagnose, and then we'll see something about the treatment. Okay, so let's get started. So first, the topic is malignant otitis externa. Malignant otitis externa is also called the necritising otitis externa. It's defined as an inflammatory condition of the external auditory canal. So basically this canal which is connecting the tympanic membrane to the external ear. So the external auditory canal, whenever it's going to be inflamed, we are going to call it the malignant otitis externa. Okay, so do you hear that? That's right. And then the causative organism is going to be Pseudomonas aeruginosa is going to be the main causative organism. The age group of people who are going to be affected is old people, especially people who are having these predisposing conditions like diabetes, or the person has some immunosuppressed state. So for instance, if the person is either on tablets which cause immunosuppression, or he has a disease which causes immunosuppression. Either ways, if his immunity is going to be very low, then obviously a person is going to get this ear infection. Well, clinical features are pretty much similar to the condition called the diffuse otitis externa, where there's going to be excruciating pain of the ear, but the striking feature is that there's going to be granulations seen here. Okay, so there's this granulation, like we basically will see granules of pus or the necrotic debris. So basically granulations will be seen, and often it's going to be associated with facial paralysis, because facial paralysis means the facial nerve is going to be involved. And in addition, the infection could also spread to the brain or the skull base, which is basically the middle cranial fossa. It's going to spread over there. Sometimes it also will spread to the foramen where the jugular vein passes. So into the jugular foramen also it can spread. So when we move on to the cranial nerves which are going to be involved, they don't say there's a hard and fast rule as to what cranial nerve is going to be involved. What we know is there's going to be multiple cranial nerve involvement and multiple cranial nerve palsies. So, specifically speaking, where all will this thing spread? So, where all will it spread? The pathology spreads anteriorly. It also will be able to spread posteriorly. It also will be able to spread medially. So anteriorly, if it is planning to spread, so this is the ear. In front of the ear is the jaw like this, and there's this temporal bone. So basically anteriorly it goes to the temporomandibular joint and cause a lot of pain, especially when the person is eating. Then behind the ear, that is posteriorly, there's this mastoid. So to the mastoid it will go posteriorly, and then if it goes medially, meaning like inside medially from external ear, it can go to the middle ear. So there are all these problems where the disease can spread? Well, in addition to the middle ear, can also go to the petrous part of temporal bone. Well, how do we diagnose such a condition? For diagnosis, what we use is based on clinical features. So with the help of clinical features, we'll be able to diagnose it. So the main clinical feature is going to be there's a lot of ear pain. So there's going to be severe otalgia, which makes a person cry literally. So our grandpa will cry. And it is typically a person who is an elderly diabetic on insulin treatment. And in the ear on examination, we would be able to see granules or granulation. Okay, so all these granulation tissue is going to be present in the external auditory canal. So the exact site in the external auditory canal, so as to where we find out the granulation tissue is that, this fact needs some recall about the anatomy. Okay, so there is this ear, there's this external auditory canal, so there is this outer part and the inner part. So this is the outer part and this is the inner part. So the outer part is going to be made up of cartilage, whereas the inner part is bone. So the junction between the bone and the cartilage is going to be the main part where we would find a lot of granulation tissue. Okay, so after making a clinical diagnosis, what are we supposed to do? How are we supposed to investigate the patient? So investigations are also done. Well, the set of investigations will aim at locating how much bone destruction has occurred or how much soft tissue destruction has occurred. So for bone destruction, we use a chemical called technetium-99. So technetium-99 is a very good scan, but however it has a property by which we will not be able to use it for monitoring, because for 1 year after the development of malignant otitis externa, the technetium-99 scan is going to be positive. However, for soft tissue destruction, we have yet another scan called gallium-67. Gallium-67 is a pretty good scan where it works in the basis of uptake by the reticuloendothelial system cells or the monocytes. So they are going to uptake it, and that's how the principle works for gallium-67. However, gallium-67 could be obviously used for monitoring. So once in a 3-week duration or time period, we would advise the patient to get themselves checked with gallium-67. So with this, we'll move on to the treatment. So the treatment for all these problems will come in this way. Okay, so the main thing for the treatment is that we are supposed to control diabetes, because diabetes is going to be the main cause why the person suffers a lot. So first, control diabetes. Second, clean the ear. The ear has a lot of discharge, it has a lot of debris, a lot of dead tissue, and we would obviously want the ear to be cleaned right before expecting very clean recovery. So for that, we do a thing called the external auditory canal toilet. So what we exactly do is that we remove all the dirt, the debris, the discharge, the granulation, and the dead tissue or the dead bone. We are going to remove everything. Third is the classic antibiotic treatment. Antibiotics are going to be aimed against Pseudomonas. So they are basically anti-pseudomonial. Well, it could be empirical, or it can also be based on cultural and sensitivity report after some time. However, the optimum duration of treatment is going to be somewhere between 4 to 6 weeks or more. We look at a time span which is approximately 4 to 6 weeks. Okay, let's list what all the antibiotics which are very good for treating this condition. The first set of antibiotics which can be used include a combination of gentamicin, which is an aminoglycoside, and ticarcillin, which is a penicillin group. Second group of antibiotics is that third generation cephalosporins along with aminoglycoside. And the third group of antibiotics is the quinolones such as ciprofloxacin, ofloxacin, quinolones along with rifampicin. So all these regimens are very good, but what is most favored is the third regimen because it's given orally, whereas these two might require IV doses. Okay, so obviously an injection is going to be hard and painful, but oral tablet is much better. So the duration of treatment, as we already know, it's 4 to 6 weeks. That's optimum. And there's a good news for you too. So initially, the treatment for this condition was surgery. But now, since the advent of very good antibiotics and very good compliance of the patients, we had prevented surgery for, correcting this condition. So everything could be treated medically itself. Okay guys, thanks for watching today's video. If you like my video, give it a thumbs up and don't forget to click on that subscribe button and that like button as it keeps me motivated to make more videos. Thank you.